It's Dr. Cherokee, and I'm back to talk to you about my advanced pharmacy practice experience throughout 4th year, and this is rotation number 3, and I did transplant pharmacy. First off, love this rotation. At this point, I love my first rotation in community. I love my second rotation in admin and the corporate managed care kind of business. And I love my third rotation at a transplant in the hospital with a transplant team. So what I did for this one was the pharmacist that was my preceptor. He was in charge of both inpatient and outpatient duties for the kidney transplant service. And so what I got to do there is, as patients were coming in needing a transplant or trying to be put on the transplant list, we talked to them. We kind of went through their medications to see how well they knew them, since transplant medications are so important. We kind of talked to them about what to expect if they are put on the list, and what to expect with the medications, just to kind of gauge. It was cool because it was kind of like the way that my preceptor asked questions, it was kind of like he was gauging their understanding and also seeing if they're a good fit for being able to keep up with all the things you have to do after a transplant. So that was cool. After that, we would also be in charge of going to following up with the patients that were in the hospital getting kidney transplant like then. So we always had, at one point we had 3, but at one point it was like 6, 7 patients at once that we were following up on post-op after their kidney transplant. And what's important is that after that, we're trying to make sure that the kidney is working well. We're trying to make sure that the kidney is right for these patients, or not right, but make sure that they're working well so that they start producing urine, that their electrolytes, potassium, sodium, magnesium, that they level out so that we know that the kidney is now filtering appropriately, as well as diuresing or getting rid of fluid from the patient like they need. And so being able to talk to the patients that way, inpatient, make sure they're doing okay, and watching them go from, kind of just getting the news that there's a kidney there, going into the surgery, coming out, and then recovering, and then being able to, the part I love the most about it is that because there are really specific transplant medications that patients need to take, and the way that they take them is specific, and the fact that you can never miss a dose of your transplant medications or you're at risk of rejecting the organ. And so we have an extensive discharge patient counseling portion that we do for them, and I love that because we literally sit there, we take all the time that the patient needs, we open up their new pill box, it's extensive, we give them most of the times the 3 transplant medications that they need, as well as 2 prophylaxis medications that they'll need to be taking for at least a few months, and then any other electrolyte replacement medications that they need to take because it's still kind of wonky. And on top of that, any medications they were already taking for like blood pressure or diabetes or things like that. So all of this all at once for the patient, it's very overwhelming, but I loved how individualized and how caring we were. And not to mention that when we rounded with the team, it was always the dietitian, the surgeon, the nephrologist, the pharmacist, the social worker, and the nurse practitioner. And they took time presenting the patient and really talking about every single thing to do with that patient. And so I love that aspect. I didn't think I'd like inpatient, but I like that inpatient. And then you go to afterwards. So now the patient leaves the hospital, but it's a kidney. So they have to come back like in a few days or a week for us to monitor their kidney transplant medication levels. So I got to see the same patients come back and say, hey, I remember you, things like that. Come in, we would counsel them again on their medications, make sure they're still taking them the right way, see what their levels are, adjust if we need to, see how they're doing, and then let them go on the way again. So for my transplant rotation, I got a big dose of 3 different sides of transplant pharmacy. Intake to see if the patient should even get a kidney, should be considered to get a kidney. And I got to sit on selection committee meetings where they laid out all the patients from all disciplines and they just looked at them holistically and saw if they were a good fit. So I got that portion. Then I got the inpatient portion of actually seeing them in the hospital, getting a transplant and helping them get back to health. And then outpatient to see the follow-up and to make sure they're doing okay. I love talking to people. I love talking to patients. I love helping patients. I love answering questions. Like, this rotation was amazing. And to top it off, I got to see a kidney transplant. They let me, on my first week there, go in and watch a surgery for a transplant. And not just watch from on the TV or from the sidelines. The body was right there. There was a stool. It was me and two other medical students that were that were there, and they let us take turns stepping on the stool and going like this, and the body was 4 inches from me. Like, I saw the kidney, I saw it pink up, I got to help close the staples. That was an amazing experience. First and very last time, not doing it again. But yeah, so I love my transplant rotations. Not all hospitals are like that though. Like the other hospital I'm in, the transplant pharmacists there, they're kind of in the basement, and they don't, it's kind of, this one pharmacist does not do all of those things. It's one's inpatient, one's outpatient. So you kind of got to choose, but, or not choose, get told what to do. So it's different, but I really enjoyed my experience there. And I was really considering becoming a transplant pharmacist from this rotation. But yeah, if you have any questions about my rotation or any questions for me about APPEs in general, let me know below and I'll get back to you. Thanks.